Bismillahirrahmanirrahim. So this is my third video regarding the MCQs of the escaping, and this is not only for gynae people. All other candidates can also watch this. So this scenario is very important, that the patient came with the history of gastrectomy 1.5 years back. Now the patient will develop. Now after gastrectomy, two most common anemias are iron deficiency anemia and B12 deficiency anemia. Now if they give you, they will always give you a clue. This is not only time duration. So if they give you a clue, like a patient is having dysphagia, this goes with the iron deficiency anemia. A patient is having koilonychia, spoon-shaped nail, this goes with the iron deficiency anemia. A patient is having low MCV, this goes with the iron deficiency anemia. Or if say the patient is having tingling in the hands or feet, this goes with the B12 deficiency anemia. Or if the question says the patient is having MCV more than 96, this goes with B12 deficiency anemia. Or if the question says the patient is having segmented neutrophil on microscopy, this goes with B12 deficiency anemia. Now we have to look for the clues. Most of the time we utilize this, that if it comes 6 months we have to pick this option, and if the question says 1.5 years we have to pick this option. Well, there are a lot of MCQs on the USMLE forum in which they have mentioned 1 year and the 1.5 year, and the MCV is 64. That is actually iron deficiency anemia. So we have to look for these clues. If none of these clues are not there, well, there is possibility that this is the poor recall and there are a lot of clues to pick a specific answer. But if there are no clues and there is only time duration, so it is said if the duration is less than 6 months, this is iron deficiency anemia, because the B12 stores are sufficient enough to take you to 6 to 12 months. And if the question says duration of more than 6 months or more than 1 year, then it is B12 deficiency anemia. But most of the time they will give you a clue. But in this scenario you can see, so the answer over here is B12 deficiency, because they have given you a more duration. Now coming toward the next scenario, parturition started by which of the following? That is fetal cortisol. The fetal cortisol that it enters into the mother circulation and that disrupts the progesterone and estrogen ratio, that leads to the parturition. Correct about basal ganglia. Now you have to keep the picture in mind of this MCQ. The internal capsule lies medial to the globus pallidus. You have to keep that picture in mind. You Google it and you have to, because the photographic memory lasts longer. So the internal capsule, if you see, that lies medial to the globus pallidus. Not going to the detail because MCQs will come in the later section. Now a case of splinter hemorrhage, straightforward case, that is blood culture. Case of infective endocarditis. So blood culture, straightforward case. The head is about half of the CRL, crown rump length 8. Now this is right, that is the beginning of the 3rd month. Another MCQ is the head is 1/3 of the CRL, that is at the beginning of the 5th month, because initially the head is big and the body is short, then the head goes short and the body become big. Now they will confuse you with this scenario. A patient is having excitability, seizures, and the calcium is very low, that is 6 milligram. Sugar is normal. So they will give you two options, the tetanus and tetany. Now you have to pick the tetany, because tetanus is not the hypocalcemic muscular spasm. That is actually another disease. So the answer over here is tetany. Preterm labor, that is caused by bacterial vaginosis, and the treatment of choice for bacterial vaginosis is metronidazole. Current guideline says metronidazole is safe in pregnancy. Treatment of choice for Trichomonas vaginalis is metronidazole. Another MCQ is MCQ number 57. Steroid hormone, it acts by that is by activating genes, by modulating genes. So it combines with the receptor in the cytoplasm, and then that complex moves toward the DNA and activate the certain genes. So the option over here is right. Non-fluent plus few words, which area is involved? So we are having two areas that is related with speech. Most common cause of aphasia is ischemia. Most common cause of aphasia is ischemia. So we are having a Wernicke's aphasia and the Broca's aphasia. The non-fluent speech is Broca's area. The speech is not fluent. Pa, ja, yes, ala, no, pa. So there can be words, but your speech is not fluent. So that is Broca's. Fluent speech is seen in Wernicke's. In Wernicke's area, there is a problem with the comprehension. You cannot understand the thing, but you can produce the speech. So that is Wernicke's area. What is sensory aphasia? Sensory aphasia means that is coming toward the brain, so comprehension. So that is Wernicke's aphasia. Sensory aphasia, problem with the apprehension, Wernicke's aphasia. Motor aphasia means production of speech, Broca's aphasia. Motor aphasia is Broca's aphasia. And Broca's aphasia, this is non-fluent. Wernicke's is fluent. Now what is the blood supply of the Broca's area? That is anterior branches of MCA, middle cerebral artery. What is the blood supply of Wernicke's area? That is posterior branches of middle cerebral artery. Posterior branches of middle cerebral artery. Now we have to know about the Broca's area is what area? Brodmann's classification. So we have to look for that, and we have to look for Wernicke's is Brodmann's area, what area? So along with that we have to know about that too. So increased GFR is due to, that is a clear-cut question, that is decreased afferent arterial resistance. When your afferent arterial resistance is decreased, so what happens? There is more blood coming toward that area, and when there is more blood toward coming area, there is more GFR. Decreased efferent arterial resistance will decrease GFR because more blood will be leaving. So it is decreased afferent arterial resistance. Immediate effect of severe hypovolemia. Now there are two MCQs on this. What is the immediate sign of hypovolemia or hypovolemic shock? That is tachycardia. What is the confirmatory sign of shock? That is decreased urine output. Decreased urine output. But over here, immediate effect of severe hypovolemia, that is oliguria, because you are having no tachycardia. Movement of thyroid gland on deglutition is due to attachment with, so the option B is right, attachment of gland to a pretracheal fascia. But which part of the tracheal fascia? That is posterior suspensory ligament of Berry. You have to keep in mind. So the CPSP can actually revolve and rotate your mind. That is posterior suspensory ligament of Berry. That is actually the condensation of the pretracheal fascia. So if that option is an option, you have to pick that. Now this is very important. The respiration, breathing, epidiameter and transverse diameter. So coming toward that. So this is that Berry's ligament. That is the attachment of pretracheal fascia. So there are three MCQs. That is the vertical diameter of the chest. the vertical diameter of the chest is affected by diaphragm. The vertical diameter of the chest, that is increased by contraction of diaphragm. When the diaphragm contracts, so the vertical diameter is increased, and the vertical diameter is decreased due to relaxation of diaphragm. So the vertical diameter has to do with the diaphragm. Now coming toward the lateral dimension. The lateral dimension, coming toward this phenomena, focus on this area. The bucket handle moment increases which diameter? That is transverse diameter. The bucket handle moment increases the transverse diameter. Another MCQ is the pump handle, it increases which diameter? The interior posterior diameter of the chest is increased by the pump handle. So we are having 3 diameters and we have to utilize these things. Now the pump handle and the bucket handle, these increases the 2 diameter, but both of these movements are caused by elevation of the ribs, and the elevation of rib is caused by external intercostal muscle. So your option over here is external intercostal. Now the next MCQ is from the 3rd and 4th pharyngeal arches develop. So that MCQ was regarding the pharyngeal arches, that the 3rd and 4th pharyngeal arch give rise to which. So the most probability is they are asking about the structure which develop from the 2 pharyngeal arches. So if you see the options, the 3rd and the 4th arch, so either it is the 2nd and the 3rd arch which give rise to hyoid bone, 2nd and the 3rd which give rise to hyoid bone, or it is 4th and the 6th arch which give rise to the cricoid and other laryngeal cartilages. 4th and the 6th give rise to cricoid and other laryngeal cartilages. So the concept of that MCQ is you have to know about these, you have to go through these pharyngeal arches and pouches. Now I will give you a certain MCQs. Which arch is missing? How many arches, pharyngeal arches are there? 1, 2, 3, 4, 5 is missing. There is 6. Initially there are 6 arches, but the 5th one degenerates. The 5th arch, it degenerates. So which arch is missing? Total arch initially is 6, but the net arches, that is after degeneration, the 5th one degenerate, that is 5. So the question, if the question says which arch is missing, that is 5th arch. What are the total number of arches? That are 5. Total number of arches 5. This is one MCQ. Another MCQ is which arch degenerates? That is 5th arch degenerates. And then you give a rate toward these. First arch give rise to which nerve, then 2nd, 3rd, then 4th, and then 6th. Now if you see what is meant by cleft, pouch and arch, we have to understand just a concept. If you are looking from the inside, suppose this is one arch, this is another. From inside it is covered by a layer, endoderm. In the arch there is mesenchyme, there is mesoderm. Outside the arch there is ectoderm. So you are having actually the organization of the 3 layer. So from the inside, that is what, if you are seeing from the inside, like for example if you focus on this, from the inside that is pouch. The spaces between the 2 arches from the inside is pouch, while the spaces between the 2 arches from the outside is cleft. But that is the basic concept. While the arch itself is made of the mesoderm. Simple. So this is very important. The pharyngeal clefts, what are their derivatives? Now simple. The first pharyngeal cleft gave rise to the external auditory meatus. External auditory meatus. Now if the pharyngeal cleft is having defect, how it will be represented? So this is the answer. Periauricular can result in periauricular cyst or fistula. So if you are having Now the MCQ, there is MCQ on this. A patient comes to you, there is a periauricular cyst or fistula. Where is the defect? That is the first pharyngeal cleft, simple. The second, third and fourth pharyngeal clefts, they usually obliterate, they are degenerated. But there is an MCQ, that is cervical cyst or fistula. So along the interior border of sternocleidomastoid muscle, if there is a cyst or fistula, where is the defect? Second, third and fourth clefts from the outside, not pouches from the inside, not arches but clefts. Another MCQ they ask is, the clefts, the cervical cyst or fistula lies along the interior border of sternocleidomastoid or posterior. So we have also cleared that is interior border of the sternocleidomastoid muscle. So you have cleared a lot of MCQs from this, and you have to remember the nerves and the arteries that is arise from these, and this is very important. The muscles, I will make another short video regarding this. You need not to worry, but right now you have to memorize these MCQ and just get a basic concept. I make another video regarding the mnemonics for that. So this is explained in detail. Poor recall, you have to not preoccupy your mind, clear the concept. Coming toward the next. So what is the definition of subfertility, that is, or infertility? That is inability to conceive by a couple during a period of 1 year with unprotected sexual intercourse. Most common cause is anovulation, that is the option B over here, reduced ovulation or anovulation. The next MCQ is, what is the most common cause of anovulation? The answer is polycystic ovarian syndrome, that is PCOS, that is PCOS. So keep this thing in mind. The reference is up to date and USMLE data. Next MCQ is, widest part of epidural space in adult is? Now the answer to this MCQ is L2, or if the L2 is missing, mid-lumbar region. Right border of the heart. If they ask about right border of the heart and X-ray is not mentioned, then right border is formed by right atrium, but on X-ray it is formed by inferior vena cava and right atrium, both. If the both is not there, then superior vena cava and right atrium, both. Right border of the heart, if the X-ray is not mentioned, it is formed by right atrium. If the X-ray is mentioned, then both superior vena cava and right atrium, both. If both are missing, then pick superior vena cava. X-ray in pregnant woman, option A is wrong, because more than 10 rads can give a significant teratogenic effect. Option B is also wrong, because there are effects after 3 months. Option C is right over here. So the C option is right over here. So if you apply the shield, so it protects the baby. The most safe modality is ultrasound. Next safe modality is MRI during pregnancy. So the next MCQ is, there is a married lady and she's having pain. Now they have given the word married, so to confuse you with the ectopic pregnancy. But patient is having fever, leukocytosis and LMP. This is not LYMP, this is LMP, that is 3 weeks ago. So it is ectopic pregnancy or appendicitis. The answer is appendicitis. Why? Because 3 weeks. Ectopic pregnancy of 3 weeks would not cause these symptoms. That is actually 10 to 12 weeks. So this is appendicitis. And how can you differentiate between the ovarian torsion and appendicitis? The pain of ovarian torsion is sudden onset, usually caused by exertion, heavy weight lifting, or during gym, or during heavy exercise. And the patient is usually vomiting. These three things give rise to you ovarian torsion. Or if there is a history of ovarian cyst, so the cyst cause the adnexer to tort. Which are the following is essential fatty acid? So the option is right, linolenic acid, that is omega-6 fatty acid. We are having two essential fatty acid, omega-3 and omega-6. Omega-3 is linoleic acid and omega-6 is linolenic acid. हो गया. So the coagulation profile, what is not included in the blood hemostasis coagulation profile. So in the coagulation profile, we do not order the thrombin. We order the blood bleeding time, the clotting time, the platelet, the PT and APTT, and also some other studies. But we do not test for thrombin. Option E. Most important buffer of the blood is the bicarbonate. Most important buffer of the plasma is against bicarbonate. Most important buffer of the extracellular fluid against this is bicarbonate. Most important buffer of RBC is hemoglobin. Not going into detail. Vein which is not drained into the great cerebral vein, that is the occipital. A tall man with normal external genitalia married but have no kids. He had normal ejaculation period, but semen analysis showed azoospermia. Now what comes into your mind? This is a scenario of Klinefelter syndrome, and in Klinefelter syndrome there is azoospermia. So you are having decreased testosterone. You are having decreased testosterone, and decreased testosterone leads to decreased sperm formation. So what is the effect? Answer over here is, if you see the histology of the testes, usually these patients, if you see, there is actually fibrosis of seminiferous tubules, and there is hyperplasia of Leydig cell. So the answer over here is seminiferous tubules are actually fibrosed in these patients. So the answer is C. Or if the answer is Leydig cell, choose both seminiferous tubule and Leydig cell if both is present. If both is not present, then there must be one option, not both option. So this is actually seminiferous tubule or Leydig cell, not the Sartori cell. The Leydig cell are responsible for the sperm production, and these are having low testosterone because of these things. Which of the following is true about the quadrate lobe? Now this is very important. The segment number 1 of liver is caudate lobe. Segment 4 of the liver is quadrate lobe. The caudate and quadrate lobe both are the anatomical part of the right lobe. Each word that I am uttering now is an extra MCQ. The caudate lobe is drained by both right and left hepatic duct. So this is an physiological independent lobe. Anatomically it is in the right lobe, the caudate lobe, not the quadrate. Caudate lobe is anatomically in the right lobe, but functionally it is independent lobe. The quadrate lobe, it is anatomically in the right lobe, but functionally it is left lobe. Functionally it is the part of the left lobe. Why? Because it is drained into the left hepatic duct. So the option B is right. The option over here, option B is right, drained into left hepatic duct. Option A is not right. It is not functionally part of the right lobe. It is functionally part of the left lobe. Anatomically it is or structurally it is a part of the right lobe. Now option C is also wrong. That is for caudate lobe. lies between the inferior vena cava and ligamentum venosum, that is caudate lobe, not the quadrate lobe. So over here the option B is right. Patient is pregnant and suddenly faints. Now this is straightforward MCQ, the inferior vena cava. So there is a pressure on the inferior vena cava, there is decreased venous return to the heart, there is decreased BP. Polyarteritis nodosa, straightforward hepatitis B, option C is right. While doing LP, straightforward there is damage to ligamentum flavum, option D, right. What does drug do to the body? The answer is pharmacodynamic, that is the right option. But what the body does with the drug, that is pharmacokinetic. The absorption, the distribution, the excretion, that comes under the pharmacokinetic. The mechanism of action, that comes under the pharmacodynamics. So what does the drug do to the body? That is pharmacodynamic. What the body does with the drug, that is pharmacokinetics. After normal delivery in primigenia and the alive and healthy newborn is given feed, that is immediately after birth. Immediately after birth. If that option is missing, choose shortest time. So over here it is about half hour. Pick that. Mucus is not secreted by, that is bronchioles. The bronchioles have no mucus. All other things have mucus. Apex of the heart, an important MCQ. It lies 3 to 4 inches from the midline or from the mid-sternal line. 3 to 4 in the 5th intercostal space, 3 to 4 inches from the midline, or 7 to 10 centimeter from the midline, or 1 centimeter medial to the mid-clavicular line. So 4 options you have to look for that. The right option is missing. The apex of the heart, 4 inches, 3 to 4 inches from the mid-sternal line, 7 to 10 centimeter from the mid-sternal line, or 1 centimeter medial to the mid-clavicular line. So you have to keep in mind. So it is 4 inches from the median plane. What age the head of the fetus become exactly half of the length of CRL, discussed previously, that is the beginning of the 3rd month, and 1/3 of the head, 1/3 of the CRL, that is the beginning of the 5th month. Now this MCQ very important. Symmetrine has anti-estrogenic effect. Now the symmetrine is enzyme inducer, keep in mind. So it has got estrogenic effect, not anti-estrogenic effect. What does the symmetrine do? It actually inhibit the liver enzyme that metabolize the estrogen, so it increases the effect of estrogen. Normally the estrogen is destroyed by liver, by enzyme in the liver. So when that enzyme is inhibited by symmetrine, the estrogen is not destroyed by liver, so the estrogen concentration become high in the blood. So it has got estrogenic effect, and it has got anti-androgenic effect. It inhibit the enzyme that convert testosterone into dihydrotestosterone, so it has got anti-androgen effect. The estrogenic effect is because of the liver enzyme inhibition. The anti-androgenic effect is because of the peripheral enzyme inhibition. I think that is one of the enzyme that convert testosterone into dihydrotestosterone. Right now I do not remember the name of that enzyme, but that inhibit that enzyme, and the dihydrotestosterone falls in the blood, and also this blocks the receptors, so it has got anti-androgenic effect. In the gynecomastia, this is another MCQ, that the symmetrine is causing it because of 2 things. One is it blocks the receptor of testosterone, it blocks the conversion of testosterone to dihydrotestosterone. Second is it has got estrogenic effect, so increase estrogen, decrease androgen, gynecomastia. So it is over here, there is poor recall, so do not utilize it. Just clear the concept so that you are not confused during the paper. But the main thing is symmetrine causes P450 inhibition, we know that. Now the shortest half-life, the correct answer over here is this oxytocin. that is about 1 to 6 minutes. This is oxytocin. Option B is correct. So I think that was sufficient for today. Inshallah, we will discuss next.